Facial paralysis is when you have weakness of the muscles of expression, and this is because of injury of the facial nerve. The facial nerve is what supplies all the muscles in the face, and it gives branches to the forehead area, to the eye area, to the cheek, to the lip region, and to the chin and the lower neck. The facial nerve will travel from the brain through the ear and into the face. So when you have injury in any of those places, in the brain, in the ear, in the face area, then you can get the paralysis. The paralysis can either be permanent or temporary. Temporary is paralysis, and temporary is because of inflammation of the facial nerve, and that can resolve on its own. And when it's temporary, high chances is because of infections, viral infections and bacterial infections. And then permanent paralysis can be as a result of tumors or fractures in the bone, the temporal bone, that is the bone that is at the back of the ear, or when you have surgery, that's a surgery of the parotid gland. That the parotid gland is a salivary gland that is located in the face area, and the facial nerve travels through that gland. So when you have injury during operation during parotid surgery, or when the whole entire parotid gland has to be removed, it will entail also removal of the nerve. Then you get a permanent paralysis. The most common cause of facial paralysis is Bell's palsy, which is very common. And what happens in Bell's palsy, you get a viral infection that causes paralysis of the nerve. And the nerve will heal on its own. So when you have Bell's palsy, we treat the symptoms, like if the patient, you're given antivirals, you're given steroids and physiotherapy, and it will heal on its own, usually within weeks up to months, several months, and it heals on its own. Other causes, you can have infections of the middle ear, which is known as otitis media. So with the infection of the middle ear, because the facial nerve is traveling through the ear, then you can have inflammation of the nerve and causing paralysis. This can also happen in children, because otitis media is very common in children. So in such cases, the patient would be treated with antibiotics, steroids, and as the facial nerve shrinks, then the paralysis will stop. Tumors also, tumors in the brain, tumors in the ear can cause paralysis. Also tumors which involve the face area, the parotid region. Others are in autoimmune diseases like lupus can cause facial nerve paralysis. Diabetes, you can get facial nerve paralysis, or even stroke can cause facial nerve paralysis. Yeah. And also trauma when you have trauma in the face area, trauma, road traffic accidents that cause fractures in the temporal bone, then you can get a facial nerve paralysis. The treatment will depend on the cause. So any patient we see with a facial nerve paralysis, we have to take a detailed history. We need to know, when did the paralysis start? How long has it been there for? What other symptoms do you have besides the paralysis? Then we do a physical examination to look out for, are there other things that you can pick up in the physical examination. And then now the treatment would be medical treatment, where you treat, depending on when the patient comes. If it's an acute process, steroids will be given. But if the patient comes after more than 2 weeks after the incident has happened, then the steroids will not have any role. In the treatment, we treat the cause, we treat what has caused the paralysis. In other cases, depending, if it's in the medical treatment, we can also use Botox to treat the paralysis. And how we use Botox is that now we use Botox in the non-paralyzed side of the face, so that you can try and achieve some symmetry. Also, surgery has been done whereby you can get a nerve transplant. The nerve can come either from the nerve in the neck or from a nerve in the leg, and it's brought all the way up to the face, so that we can try and give you symmetry in the face. It will depend on the grade. Yeah, when we have facial nerve paralysis, we do grade it. So if a grade is a mild grade, like a grade 3, a grade 2, grade 3, and grade 4, you might get back to normal. But if you have total paralysis, then you will not get back to normal. What we'll try and do is just give you at least a bit of symmetry, because most patients who have the paralysis, one, it has affected their quality of life, their social life. They don't want to go out because of how they are looking. Some are not able to close their eyes because the branch in the eye has been affected. Others, eating is a problem. So we try and give you as much symmetry and function of the nerve as possible. But if it's a total paralysis, getting 100% cure is not possible.